Hi, in the month of May, we've had a lot of upper respiratory tract infections coming into our urgent care centers in Illinois. And it's common this time of year to have kids get sick in school or people with allergies kind of flare up and turn their allergies or their symptoms into a full-blown infection. So I wanted to give this tutorial to give some education on how to prevent that little cough from getting worse. The bottom line with coughing is that there's three basic reasons that docs treat cough, or the reasons of cough. Three reasons would be postnasal drip and upper respiratory above the throat, and I'll give a link to my previous talk on eustachian tube dysfunction. And then there's lung reasons, or problems with infection, or COPD, asthma. And then there's stomach reasons, like reflux, that actually can cause chronic cough. Those are the three basics. And I'll give a link to my previous talk on reflux. But for the talk now, we're going to focus more on the lung reasons. You always have to make sure that the other two are taken care of, but if it's a lung reason, I have to think about infection. Infection, it can be spread through direct contact, talking with somebody, being in the droplet spread if somebody just coughed and is infected, or sometimes something as innocent as playing with your own children or working on a keyboard of somebody who is sick. So it's very important to wear a mask. If you are sick, or if your friends are sick, or if some family member is sick, try to ask them to wear a mask. This doesn't prevent, well, it decreases the chances of infection by stopping the spread. Because if I was to cough, anybody in that droplet spread, which usually is about a yard, is in the line of getting infected. If I wear this, then the cough goes that way or into the cloth. So it helps. Also, the kid technique of coughing into the elbow is nice, but it's not perfect. So prevention, washing hands, really important. The other thing too is herbal treatments for possible infection. In Western medicine, we don't have too many great ideas for preventing infection except for avoidance. But in integrative medicine, there's great randomized controlled trials in using my favorites for helping speed up or facilitate the healing process. Once you get infected, then you're infected, and hopefully you're healthy enough that it goes away in 5 days. But there are some things like Kella, and Kella can be found in your over-the-counter nasal spray, nasal crom. I like it. It's been around for a while. It used to be prescription form, but now you can get it at a relatively cheap price. There's also the use of Grindella. Grindella can be found in certain teas. I like Gaia brand's Bronchial Wellness Tea. It also has a couple other things like licorice root and helichrysum, and you can give it to kids. Licorice has been known to calm down the stomach. My patients with reflux take licorice root all the time. Grindella has been used to improve white blood cell responsiveness to infection and also take care of relaxing smooth muscle. If you look at the lungs, what happens in an asthmatic, you don't have to be a full-blown asthmatic to suffer from this, but I'll put it over here. These are lung bronchioles, the tubes that bring air into the lung. The tubes are surrounded by muscle. When the muscle gets irritated, it narrows down to protect the very delicate air sacs at the base of the lung. The problem when it narrows down is no air gets through, and it makes you want to cough. That's what happens when firefighters get exposed to smoke or irritation and heat. So it goes from this to this. And what we want to do if it's asthmatic is use medicines to open up the lung and relax the smooth muscle. As I was mentioning, Grindella does do that. Butterbur is a great herbal anti-inflammatory and smooth muscle relaxer that also does it. And quercetin. And I'll put the three of them over here. Grindella, you can't, it's hard to find in Illinois by itself, but you can find it in the teas, especially by Gaia brand. The Butterbur and quercetin can be found in many different places: Whole Foods, Fruitful Yield, Trader Joe's, even some independent herbal shops. You'll have to find which dose they have, but I'll put the standard doses here. Doing this will usually take an infection and a cough from a 10-day infection and or problem with cough to a 3-day. So you want to speed up the healing process is what I always suggest to my patients. Now, that's all the herbal and over-the-counter. Those are my favorites. And if you can get a licorice root by itself, then go for it. But now we'll have to talk about what to do when you're an asthmatic. If you're an asthmatic, you should have an inhaler. This is a standard inhaler. It lets go. It's essentially a canister with a mouthpiece. And you hopefully would have seen that spray. This is what happens when the canister lets go of its medicine. Technique is very important with this, because I've had actually an asthmatic show me what they did, and they held it out here and inhaled the smoke. It's not the way to do it. This is a clean demonstration model, but you actually put your lips around the edge like that. I like to exaggerate the movement. I let all the contents of the air out of the lungs, and then when you take a deep breath, you click. You click and or press on the button as you inhale, and you hold it, and that's when you can take this away from your lips, and you hold your lungs for as long as you can. I tell my athletes, pretend you're doing a 25-meter swim. Whether you get to 25 or 12, you hold your breath, relaxing, you hold your breath for as long as you can, and you let the medicine out. Then you repeat it again, same technique. Out through the nose, click and inhale, like that. So that's the basics on an inhaler, whether it's an albuterol inhaler or a steroid inhaler. Those are the techniques. Usually the inhalers are 3 times a day, 2 times a day with some of the steroids, but you get on top of these before you have to get into the urgent care center or the office. This will calm down an asthmatic bronchospasm. If the asthma bronchospasm is being treated by the infection, you're going to have to kill the infection too. If it's a virus, it'll go away on its own. If it's a bacteria, you might need to get those herbals that I mentioned earlier, or an antibiotic. Now I'll put my favorite 2 families of antibiotics over here. It's essentially penicillin or the penicillin cousins, and or the macrolides. Those are the basics that we give in the emergency room or the urgent care center to wipe out the majority of bugs that cause problems here or in the upper respiratory tract. And again, if you have to be on an antibiotic, please, 30 days of a probiotic. I'll put a link to the probiotic discussion I had before, because you want to rebuild the gut flora that got wiped out when I gave you the antibiotics. This is a nebulizer, and different nebulizers for different centers, but essentially it's an air pump. The air pump pumps air through the tubes, and then most of you asthmatics will know that you hold this one tube with the air and the medicine. It's essentially the albuterol medicine in steam form, and you take an inhale for about 5 to 10 minutes of the medicine. And in some places they actually have little masks for the kids, but this can be given to the kids. It's just a very concentrated amount of bronchodilator. Sometimes we'll mix it in with ipratropium bromide to also relax the smooth muscle faster, but it's essentially to get medicine deep down to the lung as quick as possible. I can usually do this in the office. Did it yesterday for somebody that was mild and just coughing a bit, in addition to all the other medicines I gave her, because she was high risk. She was a healthcare provider, but just decided to throw it on before she left, and she felt a world of difference before she left. So sometimes this starts the process. As most of you know, I'm an MD, but I also practice integrative medicine, so I use as many herbal things as possible, or natural things, including acupuncture, naturopathy, homeopathic medicines, and just rest and proper nutrition, avoiding dairy products. But if I have to, you got to be on the prescription medicines. You just have to use them wisely. So in a nutshell, that's what I usually do for the average person that comes in. If it seems like there's more than usual to this cough, if there's anybody that's a smoker chronically or coughing out blood, no, there's other things to consider, like chest x-rays, CT scans for pulmonary embolism, and then other things like COPD, but that's more advanced. And just for the purposes of this, hopefully there's enough information to at least get a foothold on a little symptom that might be able to turn around with the right approaches. Again, if you have to come in, you have to come in, but a lot of these herbal techniques and or treatment plans can also be used in kids, but either come back to the office or ask your provider for some special guidance in those matters.